program of immunization. Is it clear? Of immunization that you have to explain to the mother, the EPI. That's the expanded program of immunization that you have to explain to the mother. Now, after speaking about all those postpartum, you have to do postpartum counseling. Is it clear? So for vaccination. So that was the fourth element. The fifth one is going to be the family planning. Family planning. Is it clear? Family planning. Now, in the family planning, you need to speak to the mother. Ezekiel, you need to speak when she, how, the, when the, in family planning, the first element is when to resume contraception. Ezekiel, when to resume sexual intercourse, sorry, when to resume sexual intercourse. And the time you're supposed to resume sexual intercourse is one, when the woman feels when she already starts feeling the need to have sexual intercourse, when she's emotionally, she's physically, when she is mentally stable for her to start sexual intercourse. It can go up, it can even start from the first day after postpartum. And now the second one is after when she has to resume sexual intercourse, you need to know that what the best time for a woman to resume sexual intercourse biologically, based on her biology or her physiology, is 2 weeks after delivery, because at 2 weeks after delivery it's already thought that the cervix has completely closed. Is it clear? Now the next thing after talking about resuming sexual intercourse, you must speak about family planning. Is it clear? The woman should choose the method of contraception in order for her to have an effective family planning. Is it can contraceptive method can be divided into hormonal. Is it clear? It can be divided into barrier method. You have hormonal method, you have barrier method, is it clear? And you have other chemical method. Hormonal method, you can use oral contraceptive pills for the woman. Is it clear? The oral contraceptive pills can be taken orally daily for the whole cycle. Or she can also have she can take oral contraceptive pills, or she can also take progesterone injection, which is going to confer protection for 3 months. She can take progesterone injection, confer protection for 3 months. Or seeing hormonal, she can take progesterone implants. Is it clear? For that is going to confer protection for 3 years to 5 years. Is it clear? So those are the different things that you have to take. Now for the barrier, there is usually condom, which can be male or female condom, and then for the chemical we have spermicide. Is it clear? So those are the different methods. You can choose any of the method of contraception, but the best which are chosen by most women and which is going to be last long is going to be this hormonal method. Another chemical method is by using levonorgestrel. Is it clear? And that levonorgestrel is taking is an emergency pill that is taken within the first 72 hours after sexual intercourse. It's still a chemical that can also be used. Is it clear? So those are the different elements that you need to evaluate in the case of family planning. Now, after family planning, the sixth element is going to be, so for the sixth element, you have hygiene. So in the hygiene, you must speak about the hygiene of the mother and the hygiene of the child. Is it clear? The hygiene of the mother has to clean well her nipples in order to prevent that the child should be infected. She has to clean well her body and all those things. Now for the hygiene of the child, is that one, she has to bathe the child at least 2 times per day, 2 times per day. Is it clear? In a warm bath, there is no need to give too much soap to the child. No, there's just just need a warm bath, provided that now the child is infected with different skin rashes before you can use now chlorhexidine in form of ceteal. Is it clear? So you just need to bathe the child 2 times per day with warm bath. Soap, you can just need you can use soap, but if soap is not not obviously needed. Is it clear? Just a warm bath. Now that is for hygiene, the hygiene of the child and the hygiene of the mother. Is it clear? You need to also speak about the hygiene of the umbilical cord. Is it clear? Now generally you need to know that what the umbilical cord, you need to, at first we sprayed alcohol. We need to spray alcohol at the level of the umbilical cord, because the umbilical cord, the alcohol is going to dehydrate the umbilical cord so that the umbilical cord can dry fast. But now the alcohol spray at the level of umbilical cord is not said to be more, is not it's not again said to be effective, because alcohol can also attach the bacteria to the level of the umbilical cord. Is it clear? Now the next thing after the umbilical, after the alcohol, we can also, the best thing that we now do for the umbilical cord is just to clean the umbilical cord and leave the umbilical cord exposed. You expose the umbilical cord out of the pad. You should, the umbilical cord should not be inside the pad. Like some women put the umbilical cord inside the pad of the patient, and the umbilical cord get infected by the feces, is it can the urine of the child. No, the umbilical cord need to be exposed out of the pad and even out of the dresses in order for it to be exposed to air, and it's going to dry off. Normally it should be dry off by the within the first 7 days. The umbilical cord should dry off. So that's for hygiene. Now the next one, the seventh element after hygiene. So the seventh element after hygiene, now we have also the rendezvous. Is it clear? The rendezvous, you use the rule of the first 6, the second 6, and the third 6. The first 6 is 6 days after delivery. Is it clear? The next 6 is the 6 weeks after delivery. The woman should have rendezvous with you 6 days after delivery. She should have 6 weeks after delivery, and she should come back 6 months after delivery. Is it clear? 6 weeks is the best time for that is going to conclude the puerperal period. 6 weeks conclude the puerperal period. Is it clear? 6 weeks complete the puerperal period. That corresponds to 42 days. But now there are certain disorders that occur at the level of 6 months, and the major disorder that occur in women up to 6 months. We have two major postpartum complications. The first postpartum complication, we have postpartum psychosis and postpartum depression. Is it clear? Postpartum psychosis and depression occur at the level of 6 months. Is it clear? And the second complication that occur at the level of 6 months that I have not said in the other postpartum complication is postpartum pericardiomyopathy. Is it clear? Postpartum cardiomyopathy or postpartum pericardiomyopathy. Is it clear? And this postpartum cardiomyopathy is as a result of a dilated cardiomyopathy. Dilated cardiomyopathy. Is it clear? Because pregnancy is associated with a state of a fluid overload and also changes of the heart. So the heart becomes dilated, and you have a form of cardiomyopathy called dilated cardiomyopathy that may occur even after 6 months postpartum. Is it clear? So those are the different things that you have to evaluate in postpartum complications. So from here, we say thanks for your kind attention. Please don't forget to like and subscribe for our channel. SC Charles Thank you.